The laughter hit her before the door fully opened. It wasn't nervous laughter, or the awkward kind people use to fill silence. It was the kind that comes from comfort, from years of owning a room so completely that nothing in it could possibly surprise. Dr. Harrison Webb laughed the way men laugh when they already know how a story ends. "And who," he said, turning slowly from the window. "Let you in here. Selena Pruitt, Chief of Cardiac Surgery, Whitmore Medical Center, appointed 3 weeks ago by the Board of Directors, stood in the doorway of the Senior Physician's Lounge and said nothing. She didn't need to say anything yet. The hospital had a smell that Selena had memorized long before she ever worked there. She'd first walked through its front doors at 9 years old, holding her grandmother's hand, while her grandmother held a paper cup of bad coffee and tried not to look scared. The cardiology ward on the 6th floor. The same ward Selena now ran. She remembered the way the doctors moved then, fast, certain, parting the hallway like water. She remembered thinking, that's what authority looks like, not loud, just certain. She'd spent 22 years becoming certain. Johns Hopkins undergraduate, Columbia Medical School, a residency at Cleveland Clinic that her attending called the most technically precise he'd supervised in 15 years. A fellowship in minimally invasive cardiac procedures. Published research in 3 journals. Then an offer from Whitmore, not to join the department, to lead it. She was 31 years old. Harrison Webb had been at Whitmore for 26 years. The morning it started, Selena arrived at 6:45 the way she always did. She carried a black leather portfolio, the kind with a zipper that goes all the way around, and inside it were her notes for the department meeting at 9, her surgical schedule for the week, and a letter she hadn't told anyone about yet. The letter was from the American College of Cardiology. She'd been selected to present the department's research at the national conference in April. It was not a small thing. It was, in fact, a very large thing. The kind of thing that would put Whitmore Medical Center on a national map it had been quietly trying to reach for years. She planned to share it at the meeting. She didn't get the chance. She was walking past the Senior Physician's Lounge when she heard her name. Pruitt, not Dr. Pruitt. Just Pruitt, the way you'd call after dropped someone who'd dropped something. Hold on. She stopped, turned. Dr. Harrison Webb stood in the doorway. He was 63, silver-haired, with the particular posture of a man who'd been told he was exceptional for so long that his spine had started to believe it. He had a coffee mug in one hand and the other rested on the door frame like he was holding the building up. "The 9 o'clock," he said. "I need you to push it to 10. Selena looked at him. "The 9 o'clock is a department meeting, Dr. Webb. The surgical fellows are presenting their Q1 case reviews. I have a conflict. Then I'd suggest sending someone in your place. The fellows have been preparing for 2 weeks. He looked at her the way adults look at children who've said something technically correct, but fundamentally foolish. Patient. Almost kind. "I'm the senior attending in that department," he said. "I've been running those reviews since before you were in high school." "That's no longer your call to run," Selena said. "But you're welcome to attend. 9 o'clock. She turned and walked down the hall. Behind her, she heard him exhale, not quite a laugh, not quite a sigh, something in between. The sound of a man deciding a problem was too small to deal with today. She logged it, filed it, kept walking. The meeting went well. The fellows were good. Sharper than Selena had expected. One of them in particular, a second-year named Marcus, whose case analysis on a post-TAVR complication was the kind of work you submitted, not just presented. She told him so afterward. Harrison Webb arrived at 9:52. He took his usual chair at the head of the table, a seat Selena had deliberately not sat in, because she'd chosen the chair at the center of one side, where she could see everyone. He sat down like the meeting was still going. He looked at the empty projection screen. He looked at his watch. He said nothing, but his presence shifted the air the way a cold front does. You feel it before you understand it. After the room cleared, he stopped her near the door. "I want to talk about the Harmon case," he said. "The triple bypass scheduled for Thursday. What about it? I've been following that patient for 4 years. I'd like to be in the OR. Selena paused. That was reasonable. More than reasonable, actually. Continuity of care mattered, and a surgeon who knew a patient's history was an asset. You can scrub in as secondary, she said. I'm lead. The silence that followed was 2 seconds long. She counted. I have 240 bypass surgeries, he said. I know your record, Dr. Webb. Then you know that I've been doing this since before I was in high school, she said. Yes. You mentioned. She shifted her portfolio to her other arm. Thursday, 7 a.m. Scrub in by 6:30. She walked away again. What she didn't see, but a scrub nurse named Della would describe to her later, quietly in the break room, was the way Harrison Webb turned to watch her go, and the way his jaw tightened, just once, like something had been decided. It escalated the way these things always do, not in explosions, in paperwork. A scheduling request, submitted without her knowledge, that moved 2 of her post-op follow-ups to accommodate a procedure Webb had added to the board. A patient who told her, gently, apologetically, that the other doctor had come by and suggested a second opinion before surgery. Had made it sound, the patient said, like something Selena might have missed. She hadn't missed anything. She requested a meeting with Webb directly. He was 20 minutes late. He sat across from her in the conference room with the air of a man fulfilling an obligation. I need you to stop going around me, she said. If you have a concern about a patient's care, you bring it to me. I have concerns about a number of things, he said, such as experience. He said it simply, like it was a weather report. You are 31 years old. You completed your fellowship 18 months ago. This department has 42 physicians and a surgical volume that this hospital has spent a decade building, and the board chose to hand it to someone who has never run anything. I ran the Cardiac Outcomes Initiative at Cleveland Clinic for 2 years. A program, not a department. I published 3 peer-reviewed studies on ventricular repair techniques that are now part of the standard fellowship curriculum at 4 medical schools. Publications, he said, with a particular emphasis that made the word sound like a hobby. Selena looked at him. She thought about 9-year-old herself on the 6th floor, holding her grandmother's hand. She thought about what she'd understood, even then, about certainty. Dr. Webb, she said, this conversation is being documented. I'd encourage you to consider what you want your record to reflect. He stood up. I've been at this hospital for 26 years, he said. I trained half the physicians in this building. I have relationships with this board that predate your medical school application. He picked up his coffee. You're talented, he said from the doorway. The word landed like a pat on the head. But talent and leadership are different things. You'll learn that. He walked out. Selena sat for a moment. Then she opened her portfolio and wrote 3 sentences in her notes. She capped the pen. She went back to work. The Harmon surgery was Thursday. It went well. Beautifully. In fact, the patient's anatomy had presented a complication mid-procedure, a calcification that hadn't shown clearly on imaging, and Selena had adapted in real time with a technique she'd refined during her fellowship, one that reduced bypass time by 22 minutes. Harrison Webb, scrubbed in, across the table, had watched. He didn't say anything wrong. He was professional, technically sound, did exactly what a secondary surgeon should do. But in the moments between, she felt him watching her, the way a man watches a thing he's decided not to respect but can't yet dismiss. After, in the scrub room, he said, "Clean work, thank you. The calcification surprised me too." "It's in the post-op notes," Selena said. "I flagged it for imaging protocol review." A pause. "You flagged it during surgery?" "I dictated a note in my head and wrote it up before I left the OR." He looked at her, just for a moment, not with contempt, not with admiration, with something closer to recalibration, like a man adjusting a formula. Then he left. 3 weeks later, Selena received a message from Dr. Owen Merritt, the hospital's chief medical officer, the man directly above her, directly below the board. The message said, "Please come by at 4. She knew what it was about. She'd been waiting for it. Owen Merritt had been CMO for 9 years. He was careful, political in the way that good administrators have to be, and generally fair. He had a round face and a habit of tapping his desk with one finger when he was choosing words. He tapped the desk 3 times. "I've received some feedback," he said, "from senior physicians in cardiology. Concerns about leadership style, communication, whether the department climate is cohesive. Who submitted the feedback?" He looked at her with the slight wince of a man who'd hoped that question wouldn't come. "It's part of a broader, Dr. Merritt," she said. "Was the feedback submitted by Dr. Webb, Dr. Fenton, and Dr. Callahan? Because those are the 3 physicians who have declined to attend the last 2 department meetings, submitted scheduling requests that bypassed my office, and, in at least one case, approached a patient preoperatively to suggest a second opinion without my knowledge." Owen Merritt's finger stopped tapping. "I have documentation," she said. "All of it. Dates, specifics, patient identifiers where relevant." She set the portfolio on his desk and opened it. Inside, tabbed and labeled, was everything. 11 weeks of everything. "I also have the department's surgical outcomes for the quarter, which I'd like you to look at before we continue this conversation." He looked at the portfolio, then at her. "You anticipated this meeting," he said. "I anticipated this situation," she said. "The meeting was just a question of timing." He was quiet for a long moment. "Selena," he said, first name which he hadn't used before, "I want you to understand that the board's confidence in you is not in question." "I'm glad to hear that. But Harrison Webb has 26 years, she said. "I know. He has relationships that I know." She leaned forward slightly. "Dr. Merritt, I'm not asking you to discipline him. I'm asking you to be clear with him about the chain of command. Publicly at the next medical staff meeting. Not a private conversation, a public clarification. Because private conversations haven't worked." He tapped the desk again, once. "That's a significant ask." "It's a reasonable one," she said, "and I think you know it." She closed the portfolio and picked it up. "I'll leave you the copy," she said. "Take the weekend to review it." She walked to the door. Then, because she'd learned something about timing, she stopped. "The ACC conference in April," she said. "I've been asked to present our department's research on ventricular repair outcomes. It would be the first time Whitmore has presented at nationals in 7 years." She saw his eyebrows move. "I'm planning to announce it at next month's department meeting," she said. "I'd love for the whole team to be there." She left. The weekend passed. Monday morning, Owen Merritt sent a calendar invite to every physician in the cardiology department. Medical staff meeting, Wednesday, 11 a.m. Attendance mandatory. Harrison Webb was in surgery, Tuesday and Wednesday morning. He arrived at 11:04, slightly rushed, still in his white coat. He took his usual seat. The room was full. 22 physicians. 3 department administrators. Dr. Merritt at the front. Selena sat at the side, portfolio on the table, hands folded. Merritt spoke for about 8 minutes about departmental protocols, communication structure, and chain of command. He was clear. He was specific. He named the chief of cardiac surgery by name and title twice, when referencing where scheduling, patient communication, and clinical concerns should be directed. He did not name Harrison Webb. He didn't have to. The room understood. The way rooms always understand things that are being said by implication rather than accusation. Selena watched Harrison Webb during those 8 minutes. His face was very still. The kind of still that isn't calm. It's controlled. The kind that takes effort. Then Merritt said, "I'll hand it over to Dr. Pruitt for department announcements." She stood. She talked about the Q1 surgical outcomes. The department's complication rate was down 8% from the previous year. She talked about the Fellows Case Review Program. She talked about 2 new protocols she was piloting, one in post-operative monitoring, one in pre-surgical imaging that would, she noted, catch calcification anomalies that didn't present clearly on standard CT. She heard someone shift in their seat when she said that, and then she pulled the letter from the front of her portfolio. "I received this 3 weeks ago," she said, "and I've been waiting for the right moment to share it." She held it up, not dramatically, just matter-of-factly, the way you hold up something that speaks for itself. Whitmore Medical Center has been selected to present at the American College of Cardiology's National Conference in April. The presentation will focus on our department's ventricular repair outcomes research work that was built by this team. The room was quiet for a beat. Then one of the fellows began to clap, then 2 more. Then it spread, the way things spread, when people have been waiting for permission to feel good about something. She watched Harrison Webb. His hands were flat on the table. He was not clapping. But something had shifted in his face. Past the controlled stillness, past the management of it. Something that looked, if you were watching closely enough, like a man arriving somewhere he hadn't expected to be. She found him afterward in the hall outside the conference room. She didn't plan it. It just happened that they were both walking the same direction, toward the elevators, and she wasn't the kind of person who crossed the hall to avoid a conversation. "Congratulations," he said. He said it without looking at her. "Thank you." They walked in silence for a moment. "The calcification protocol," he said. "Pre-surgical imaging adjustment?" "Yes." "Who designed it?" "I did, based on what I saw in the Harmon surgery." He nodded, just once. The elevator arrived. They both stepped in. The doors closed. "I trained 41 of the physicians in this hospital," he said to the elevator doors. 3 of them are now department heads. One is the CMO at a hospital in Boston. "I have spent 26 years here. I know. I want you to understand," he said, "that what I did, what I've been doing, it wasn't personal." She looked at him. "Yes, it was," she said. He turned. "It was personal," she said, "because you looked at me and you decided before I opened my mouth, and I think you know that. I think that's why you're standing here saying it wasn't." The elevator opened. She stepped off. "I'll see you in the OR on Friday," she said. "The Delacroix valve replacement. You've been following that patient the longest. I'd like you to lead the pre-surgical brief." She walked down the hall. Behind her, the elevator doors closed. 6 weeks later, Harrison Webb submitted a scheduling conflict for a department meeting, and then, for the first time, sent an email to Selena's office to let her know. It was a small thing. An email. A heads up. She read it at her desk, in the early morning before rounds, with the city still gray outside the window. Then she forwarded it to her administrative coordinator with a note to mark it received. She poured her coffee. She opened her surgical schedule. The letter from the ACC was framed now on the wall behind her desk, small and unassuming in a plain black frame she'd picked up at a drugstore. She hadn't made a ceremony of it. She'd just hung it up one evening after everyone had gone home. Some things don't need a ceremony. They just need to be there, on the wall, where you can see them every morning when you sit down to do the work.